Tetapi pada episod tersebut kakak tiada bersama kami. So
kerusi panas
today kerusi panas adalah diduduk oleh kakak SK. So we want to know your story, kakak, because amongst the five of us, you are of course our kakak, and also you hold that MD, you're a medical doctor kan? Dr. Choy Sukwen is our kakak's full name.
After I qualified, I said to my parents, can I come back into the family business? And they were shocked. Terkejut.
Hai, salam sejahtera. Selamat datang ke episod ke-69 Kita Family Podcast. Di sini kami akan membincangkan perihal yang berkaitan dengan makna serta kepentingan hidup bermasyarakat, menghargai keunikan serta kepelbagaian sesama kita dan meraihkan masyarakat yang berbilang agama, kaum, kepercayaan, rupa dan juga keupayaan. Kita menghargai hidup secara inklusif yang mengambil kira keperluan segenap lapisan masyarakat, terutama bagi mereka yang kurang atau berkelainan upaya. Hai, saya Desiree dan bersama-sama saya di studio hari ini adalah Nori.
Hai, Assalamualaikum.
Dan kakak SK.
Apa khabar?
Hari ini Didi dan Anik tidak dapat bersama-sama kami. Tapi hari ini kita akan mengadakan episod ChitChat Mak-Mak Neurodivergent dan beberapa episod sebelum ni, iaitu episod ke-66, our title was Didn't Plan on Fighting for Inclusion But Here We Are, kan? Di mana Nori moderated that episode, dan kami telah pun berkongsi bagaimana kami telah terjebak dalam pada tahap ini, dari segi advokasi sampai ke tahap ada podcast. Tetapi pada episod tersebut kakak tiada bersama kami. So
kerusi panas
today kerusi panas adalah diduduk oleh kakak SK. So we want to know your story, kakak, because amongst the five of us, you are of course our kakak, and also you hold that MD, you're a medical doctor kan? Dr. Choy Sukwen is our kakak's full name. Dan the doctor is actually a medical doctor. So
actually dalam komen ada soalan ni
kan?
Tanya mana cerita SK.
Yeah, so this is also a request from our listeners and those who watch us. So kakak, why don't you tell us your story of how you've come to this point in your advocacy? Maybe start with what made you perhaps give up. You gave up medical practice,
that
right?
first part lah, kan?
So
That, you are actually
curious.
doctor. You could have sat in that field, but we don't even know what kind of doctor, kan? So maybe she wasn't necessarily a developmental pediatrician, not a psychiatrist, or anybody, not a neuro.
Okay, adik-adik ni. Adik-adik sekalian is giving me a lot of encouragement. And thank you so much. Thank you so much to encourage kan. Let us ceritakan lah. First of all, medical doctor. I was trained as a medical doctor. Bukan MD. MD tu American system. My training in the UK. Like kan I have MBBS, So in the medical term tu, Bachelors of Medicine dia terbalik MB tu Bachelors of Medicine. BS tu bukan bullshit
Better not be.
BS tu is Bachelors of Surgery. So if you are trained, in the UK system, titlenya MBBS.
Okay.
So when I came out of university, I was in general practice. In fact, I did not specialize. I have a very interesting pathway. Sebenarnya, from medical care, I went and said to my parents, a bit of a shock to them. The background is my family are entrepreneurial family. And I said to my parents, thank you very much. I have already qualified from something I really, really wanted to do. Sebenarnya not that my parents asked me to be a medical doctor. After I qualified, I said to my parents, can I come back into the family business? And they were shocked. Terkejut benar-benar.
Kenapa kita hantar you belajar?
Well, my
berapa
parents
lama
brought
dan whatever, and then tiba-tiba nak masuk family business where you could have just asked, right? Without maybe
very
going to
interesting.
university for so long. Ish.
Sebenarnya until today, my heart and my love is still healthcare.
Okay.
Okay, and that is the true desire. But I think at that point in time, perhaps is the age of curiosity. Having got my other two brothers also in different professions, working in the family business. So I wanted to be part of the action in the family business.
FOMO.
Part of the action.
Doctor FOMO nak join family business.
So
okay.
I then took a master's degree of finance. Again, masih di UK. We are very UK centric, and had a path in business and commerce for quite a while before, as I mentioned, last year, Oasis turned 10. So the decade previous to that, sebenarnya, I was in a totally different field in the area of commerce, and it was the story of our son Joshua, when he was diagnosed with autism, that had brought me back acutely, very fast into healthcare. That's how the MBBS was put into use again.
Oh, but so it was the calling as a mother as well, to sort of come back to the medical sphere in a way, one part of the medical sphere, because of the love for your son, due to find him the best options out there, right? Because I think if we remember the story, Joshua was diagnosed in Singapore because at that time, Joshua umur dia 18 bulan dekat Malaysia, tak ramai doktor probably at that time yang sanggup diagnose at that age, right?
Betul.
So you had the background of the medical knowledge to know to bring him there.
Actually,
But you couldn't diagnose.
Not at all, kan? If I go back to the story dulunya, it was flagged by Dr. Ng, our pediatrician at that time. But I think having the medical training, perhaps lah, and enable me to understand it in a faster pace.
Yes.
I remember bila dia point out the symptom to okay, I didn't know. The last time I saw autism as a word or a description was in my medical textbook.
Wow.
Kan?
Oh, okay.
And at that time, medical textbook, autism was in the section, I remember very well, of psychiatry.
I see.
Okay, and they had description, no social interaction, and so forth. I remember very vividly. But that was all. It was a text description, and that was all the knowledge I had. However, when Joshua's symptoms was described to me, no eye contact, inability, the speech and communication delay, hyperactivity, I recognized it. I recognized it, I suppose, as a fact.
Yes.
In that way, was able to respond fairly fast.
Quickly,
Yeah,
yes.
in that sense.
So let's fast forward then to how Oasis Place came about. That was your first point of advocacy, I suppose. What made you, I mean, of course, as a parent, kita semua nak tolong anak kita, we will find the best therapist that we can afford, kan? But in your case, kakak, you actually open a space for others as well. So what was that deeper calling to also help others besides Joshua?
Yeah. In fact, it's amazing. Instinctively, you call it a calling, kan? So our journey actually, after going through therapies, different, if you remember Chokman's episode when he shares, there are so many different offerings, some scientific, some not so scientific. So our journey with Joshua was very fascinating and rewarding. Macam mana? We saw that he responded. We could see some of the response to therapy. If I remember, some even within 6 months, there was a change in even his communication, his speech. He responded. There were very good encouragement from some therapists who said, because Joshua has these, and these different attributes, we expect him to be able to be responding well and have strong outcomes.
Right.
So in that encouragement almost over 2 years, we noticed that sebenarnya therapy ni really works. Right? It's not a hope. There appear to be signs. We were introduced at that time, although medically trained, but sebenarnya the field of therapy, or what is formerly known as allied health practice, is a quite amazing and different science. Yeah? It's a continuum of the science to medical care, but it's a very precise science in many ways. So as an interaction as parents, we were learning at the same time, and we saw the difference in Joshua. And at that time, if you remember, coincidentally, Chokman, my husband, also started a inclusive kindergarten. And in that kindergarten, this was just before Joshua was diagnosed. We then saw other children who responds to therapy, responds to way that the teachers were instructing them. For that school, we had a professional clinical psychologist who had come to train the teachers, so that it can be an inclusive kindergarten. So we had observation both personally, macam mana Joshua menyambut all the therapy, and wow, it's making a difference. But beyond that, we also recognize that other children within the kindergarten also seem to respond in a positive way to therapy. So in short, our advocacy started because we were excited. We, meaning my husband, the school's principal and teachers, and we say, wow, why don't we share this? That therapy does work. And in that way, that was the birth of Oasis Place. And Oasis Place was born with a lot of contribution from our mentors who were Joshua's therapists. There was also, of course, our family who can see the changes also even within that 2 years. And because we were learning ourselves professionally, locally and internationally, we started to interact with many parents. I would say it was the parents who really gave us the courage that when you can work with professional team, as well as do whatever you can. We saw this and we met parents in international conferences who encouraged us. And that was how we started Oasis Place and working together with the school, Treetop House, as you know. And we started there. But we were very clear that this is not to benefit only ourselves, and that Oasis would be open to the public for access to many different families.
That's a very interesting journey. So the advocacy started even before Oasis Place, kan? And I think as we mentioned in one or two earlier episodes, we automatically become advocates lah. Dapat diagnosis anak, automatically we become their advocates as well. So I think in your story, Kakak, the advocacy started before Oasis Place came about with Chokman School, and also seeing both sides, right? How it worked for Joshua and how it works for other children. And I think what makes Oasis Place unique is you are always very clear that the services provided is under allied health, right? So this is more of that's why it's called transdisciplinary, right?
Yeah.
And
You don't have psychiatrists sitting with you, right?
I will share why not.
Yeah,
Okay.
so-
That's a very good statement there. I'll
Yes.
share why not.
Okay.
So
Yet.
so because this is going to lead into the next part of our conversation about allied health. So I was going to ask Kakak to maybe tell us a little bit. Yes, number one about psychiatry. I think I know the answer, but I'd like to hear it.
And just also, what is allied health?
Yeah.
Yeah.
So what is allied health? So let's set
Yeah.
that stage.
Yeah.
Okay. Just to get to the clarification, allied health practitioner, AHP for short, ataupun bahagian
Kesihatan
bersekutu, yeah, BSKP. These are practitioners. Actually, there are 17 or 22. I'll have to check that fact, but it's double digit. Different professions. Now, the one more familiar to the autism community, itulah clinical psychologists, speech therapists, occupational therapists, some physiotherapists. These are the ones more commonly known to our care needs, yeah. But this AHP extends to the X-ray technicians, the nurses. The nurses are under the Allied Health Care Act, and many other different professions. Yeah, your hospital radiologists, not radiologists, excuse me, radiographers and the technicians. Yeah.
How about counselors?
Counselors is now by history, lembaga counselor is under the separate act. These are historical. They are historical. So AHP professionals who are our immediate carers, health carers, are the ones who now under the Ministry of Health, actually under the big umbrella, AHP or BSKP is under the umbrella of MOH, Ministry of Health. KKM lah, Jabatan Kesihatan Malaysia. Why is this all important? Now, especially as the professions are getting more trained, registered, recognized, and licensed, this is a very important, if I can say, a stage of our healthcare where our practitioners are licensed so that we know they have had adequate training. Kan senang aja, because let's say if you are an engineer, everybody knows that they have to be a licensed engineer, or you won't let them build your building or build your bridge. Betul tak?
Yep.
Yeah.
So in that similar fashion, we have to give due regard to understand when we work with the health carer who is supposed to deliver the occupational therapy, they need to have professional training. Okay? Now, so coming back then to the question, Oasis does not have psychiatrists. Now, I'm a medically trained person. At that juncture, 10 years ago, I was very clear that the gap or the shortfall is at the therapist. And when we started Oasis Place, we wanted to build good
Gap
quality.
meaning in Malaysia, we didn't have enough.
We do not still. What masa ni masih dalam very, very short. We are extremely short. There's a lot of data. And Chokman and my desire was, let us do this well.
Okay.
Okay. And the immediate need are the therapists. And so we decided to grow Oasis Place services, focusing on delivering good therapy, hire good therapists to start with, and then how can we train and multiply and grow more therapists. In fact, this has been something we have been doing for all the 10 years, where continuous professional development is something that is very high in our services.
Yes.
At this juncture, we are only doing postgraduate training, whereas the therapists are actually graduated from our universities, as well as universities abroad. Yes, abroad, both local and international universities. And as you mentioned, Nori,
Yep.
and I've said this many times, one of the most pressing needs as advocates is for us to advocate to have more healthcare specialists, the clinical psychologists, the speech therapists, the occupational therapists, the physiotherapists, to increase the number of practitioners.
Okay, jadi perancangan dan pilihan supaya Oasis Place ni sebagai satu pusat, it's like it was very very specific.
Specific,
It was very specific, and memang untuk memperkembangkan lah. I would say industri yang berkaitan, nak meningkatkan lagi jumlah dan kualiti, I would say. Kalau berkaitan dengan pakar terapi lah.
So in that sense,
itu memang tumpuan utama, dan memang selama 10 tahun ni, and will it continue to be? Maybe because memang tak cukup, right?
That
it has to be. It has to be our continuous pathway. And Nori, as you know, when we first met, we met because you came as a parent to get more understanding. What we bincangkan about awareness is a very important first step.
Yep.
And masa saya sendiri keluar negara to learn, there was not much here. There was some, but we were parents who really wanted to learn forward. And we understood when we met these families, they are very, very important part of the child's intervention plan. They are the ones who open the doors. If parents don't understand why should the child go for therapy, it might look like just another gym session. It looks like just another play, and it is very, very difficult for parents to, in the context, when it's very hard to get an appointment, when it's expensive to have therapy, they must have the understanding why would they spend
so
and
much
invest the
resource,
time, the resource.
Kekangan ni memang berat actually, kan, kalau kita tengok.
So in fact baru-baru ni dalam salah satu parent support group dalam WhatsApp, perbincangan hangat lah tentang ini. Allied health professionals, how do we tell the difference between qualified therapists, what's the difference between clinical psychologists and psychology. So banyak lagi perbincangan dalam topik ni, but I think for now let's go take a quick break. Hai, selamat kembali ke episod ke-69 Kita Family Podcast. Hari ini dalam episod ChitChat Mak-Mak Neurodivergent, kami bercerita dengan lebih lanjut dengan tentang cerita kakak SK. dan terlajak pula talking about allied health. Tapi I think
cukup
yes,
sebab
yes.
sebenarnya kita
Yes.
nak dengar lebih pasal kakak kita ni. I mean, there's a reason why she's kakak. Ada pengalaman yang agak menarik dari segi medical career dia. Mungkin ada pengalaman tertentu yang membuatkan dia seorang ibu yang lebih berani atau mengambil risiko dan buat kerja-kerja yang dia buat sekarang ni lah. I think we need to go and hear a little bit more about that.
Yeah, so that journey is longer than what we heard earlier. So maybe tell us more, Kakak. I know I think most of the 5 of us, between 5 of us, we know is beyond just therapy and services. Your advocacy extends far beyond that. So tell us more, please.
Big words like advocacy come up, menakutkan sikit, ya. Tapi sebenarnya what happens is when things flow, and how I've become more active in promoting awareness is as we were learning how to be an excellent service provider, as we were learning as parents what we need to do to support Joshua, our neurodiverse son. I think what happens is it translates into what can we do. The doing is in different ways. I didn't really think about being an advocate, but in the path of our plans, macam mana kami dapat memperbaiki quality, or what should be the outcomes that we would like for our clients. We have different activities, if you like, that over the 10 years, it was faithfully, first originally just plans saja, but we conducted them faithfully, consistently, and keep improving it. One of that example is annually, kami akan mengadakan meeting or a learning just with medical doctors. This is not something obvious to our clients, but having the forum, it used to be called Unscrabble the Puzzle until it was changed to just neurodiversity. Activity like this allowed us to interact with private doctors. We invited public healthcare doctors. And it was moderated. It was designed to be moderated by somebody in from the university. Platforms like that enable us to not only learn, that sebenarnya what is important is to connect the relationships.
Relationship building.
The relationship building in
I want to jump in here.
Okay.
Because you said building already also. Sebenarnya I think you didn't think about the word advocacy. You didn't even go there, but because actually what you are is a builder.
Yeah.
It's not so much an advocate. You did push for things to happen. You just made it happen.
That's true.
And I
you
enjoy
tried,
that.
rather.
Yeah,
Yeah,
I
and
think,
then-
and then
yeah.
as you all know, I enjoy that, and I think as we build, then the results are slowly released, and sometimes we get amazing results. So coming back then to different platforms, over the years, we faithfully, even though masa COVID, I remember we continued to press on. That platform became online to continue to discuss the different changes or what's the current topic for medical care towards autism,
And not
towards
just discuss,
ADHD.
right? Teletherapy.
And yes, I mean, thank you for reminding us. In fact, we were one of the first to go into that space to prepare ourselves, and not just prepare ourselves, prepare our clients during that whole COVID period. So moving in different platforms was our way to continue to increase awareness, to engage to discuss, and again, always coming back to building relationships. Relationship tu bukan beneficial immediately, kan? That's what relationship is about. It's about then knowing who we can ask, who can we consult, which healthcare professional, some who then further on became speakers resource in different activities and conferences. Yeah,
It's an investment.
Investment of time, and again, credit to our professional team who were bold enough to believe in the story lah, that we need to do it this way, kan? Bukan saja buat therapy one-to-one or group with the typically is the therapist bersama client or the patient, or the anak-anak or even adult, but it was to go beyond. Beyond is what we see in our logo. We look at the immediate family, the ripples of who are the stakeholders.
Kita tanyalah kakak kita apa actually, you know, I like, who are you? What did you go through that you decided that you can take all this on? I feel there's missing pieces. Kita terus pergi pada bab universiti tadi, kita dah tahu pergi belajar untuk menjadi seorang doktor, tapi you know, it's like well, first of all, yes, you said your passion is like healthcare in a way, but why did you want to go become a doctor? And then I think there were, you said those decades, there's some missing pieces of some of the experiences you had. We know a little bit. I think you should share.
To share.
Yes, and
You know,
yes, share.
Nori, life is about discovery. It was only very recently that through a process of profiling, and this was one called Strength Finder, with my dear group of entrepreneurial friends who's journeyed with me in the last 23 years. We use a tool.
Panjat Kinabalu people.
The Panjat Kinabalu together.
Mendaki
Ada jadi.
Kinabalu, yeah.
We used a tool, and in that tool, the discovery was I have this profile of a very heavy learner. Okay. Memang I have this learning profile, and reflecting about that, it was also Lori. Lori was in fact, before Kita Family Podcast, I was a board member of Senior Malaysia, the Special Educators Network International Asia. Lori invited me to be on the Senior Podcast, and I was terrified. But during the podcast, she helped me coin something which I really love, and it's about me learning forward.
Yeah, the learning forward.
Do you remember
thing
that?
came from
And
that.
I'm very fond of that, and
Yeah.
that's why I always like to invite families, stakeholders to always learn forward, to plan and to prepare.
Yeah.
So that how did I become like that? I think it was pulled out lah. You know, it's released. I think in as
It was scaffolded and pulled out.
it was
Tak tahu about the scaffolded. I think sometimes she just jumped in certain things.
Because so here's my theory, right? Theory.
Okay.
Please correct me if I'm wrong. I think Kaka is a type of person who likes to push people forward to embrace their strengths, right? So for example, and she's a very good people connector.
Yep.
Right, so she can identify strengths in someone and say, hey, you know, I think you should go out and talk about this topic. And I see this all the time with the practitioners at Oasis Place, always placing them forward. But there have been times and more recently that I see Kaka herself stepping into that. Right? So maybe you can share with us what has changed maybe in you. That's why I say I think it's
Yeah, rather than
scaffolded.
just building, but
Yeah,
now you
are
don't mind
stepping-
standing on the platform sometimes.
Exactly, and I know there are some newer challenges you're taking on in terms of speaking as well. So share with us.
so when you are allowed to stand on shoulders of giants, itu dia. Giants like Nori, giants like Desiree, like Anit and
Eh, tak
Didi.
diet. Choy.
So one of this, one of it is over time. Sebenarnya I'm a very quite shy publicly, and people don't really believe that because when I go into the professional mode, I get the engine going because I need to be doing that role. If I have a preference, I would like to believe I'm actually the builder behind the scene. So in that sense, through the years, because we have such amazing professionals that has come onto the team in Oasis. Whenever there's opportunity, I always would like the team because they are the specialist. And Oasis was built.
You like them to step forward.
I need them. I like them, and I know that they should step forward.
Okay.
That it is. I learned also as a parent going to get services. We must, although we value the individual, but we must value the practice. Kalau tidak, I have seen where parents will only like to see one therapist, and I find that could be very limiting sometimes. Yeah, there's reasons for that to happen. Yeah, let's not forget that. But if the parents can also see that the team is well trained, that might be a way to broaden the health carers to serve in their different strength. Okay, I'm not sure to put it correctly. I need to pull it back. So standing on giants, shoulders of giants, help me be braver. That I need to also add my voice. And Kita family, of course, even though it's only just over a year, has bravened me, emboldened me to say the voice is very important.
And also we didn't give you a choice, right?
And you didn't give me a
We were like, we're doing this together. It was like
Okay, but look,
we're doing
you've
this.
done some other very brave things as well.
Yeah.
I think kita kena tanya directly about this certain field work lah. Ceritalah, ada juga pengalaman sebagai doktor bukan saja. I mean, I thought that was super interesting. Why are you not sharing that story?
Okay,
Come on.
I'm going to share this. That's my personal story of before I met my husband, the one that you want to dig out.
Yeah. I want to
okay,
dig out because when I heard that, I was like, whoa.
Yeah, actually, I think this
Mashallah.
is about the tsunami story, Nori. The tsunami story, if we all remember, was actually close to Christmas, and I was a new church believer at that time, and I remember the pastor in church said, you know, when you become a believer, one of the roles is to serve.
Yeah.
And when he came out to ask for doctors, medical doctors, who would volunteer to go out to Aceh. This is one of the earliest to go out to help all the rescue team. So I got onto that rescue team.
Of course, dengan ada word serve, tahu je lah siapa angkat tangan.
So I think that sometimes I check for my ADHD impulsivity trait. I always check that, but banyak kali screening pass. But that I think maybe that is my natural part of the call to healthcare. I think that natural wanting to help healthcare took me to Aceh. It was very, I must say, although I am medically trained, I have to say it's an experience that I can't imagine would be replaced because of the extent of human tragedy, of bones sticking out and so forth. But Nori, that story really helped me meet my husband, who recognized that I care for peoples. And again, I think that just underpins naturally. I am a people carer. Which brings me back to our current discussion. Macam mana you and myself and all of the advocates is something innate in us. We've had opportunity and we go forward lah.
Yeah, that's our other little connection. We both been to Aceh, and it was because of the tsunami.
So Nori has an interesting Aceh stories about, we will have an episode of interesting stories at another time. So
I have a okay. So what I want to ask is, so this is maybe like a bit of a harder one, but I think it's important to ask, and I take it that maybe because kita dah sampai pada tahap 1 dekad ya. I'm sure ada time that you have done reflection. So what do you wish to do better? There's it's 10 years. There have to be certain things or some stuff that has happened along the way where you're like, right, could have done better, or I don't know if this was, but you're on that journey. So maybe ada azam untuk memperbaiki sesuatu keadaan atau benda yang tidak dapat buat, atau mungkin kita nak dengar jugalah ialah keadaan di mana mungkin sebab kita pun tahu kan, bila kita terjatuh setelah kita belajar macam mana nak bangun, kalau tak terjatuh tu kita tak tahulah apa rasa dia macam mana, susah kadang-kadang untuk bangun. Tak tahulah kalau setakat tu mungkin ceritanya, but maybe a learning and that what can you do better. And then the second one, I also tadi kita cakap masa break, but there's a lovely story of how Oasis kicked off amongst so many hundreds of families now, but that first family and all that. So these two things I really want you to share as we finish up. Can I?
Boleh.
Okay. Thank you. Let me go to we were talking about the earliest family member that came to consult at Oasis.
You want to talk about that first?
I will talk about that first. Senang sikit kan?
Yes, senang sikit.
Senang sikit.
Saya tak boleh nak tanya. Anak kena tanya soalan susah juga.
Scaffolding her answer, easy to difficult.
Okay, right.
Thank you. I'll use those techniques.
Yes.
It's really heartwarming, especially as we were reflecting about the 10 years. And we were documenting all our cerita-cerita of Oasis Place. And that memory is there was a family that came for their consult, in fact for a diagnosis to Oasis, when we were not ready physically. We had the team working out of a temporary office, but our professional team was already employed and working. We had a call from a pediatrician who made a request. This family has come very far,
out of state, jauh,
out of state from the south, and in fact, grandma has brought the grandchild with her mum. It was a grandma who made the appointment, and grandma is asking, can you please find can you see them? They know we've explained that you're not physically renovated and ready yet. So what we did, we said, okay, we'll do that. And I remember taking out the broom.
Okay, penyapu.
And in fact, the clinician pun penyapu. And we just put out a temporary desk and a stool. And that client continued from that unrenovated, and subsequently she did very well. She travels regularly with her family weekly dalam kereta from the south, weekly, to get therapy. I think that really again adds to the why
you do what you do.
Why you do what you do?
We do what we do, and not only do what we do, but sometimes jump to do what we do. To be able to serve a family's need like that.
Penyapu, meja, bangku. Lepas tu duduk atas lantai.
Bangku. Ada bangku.
Ada bangku.
Okay,
Ada bangku.
Tak payah lantai.
Tak payah lantai. Bangku ada.
That is impinged on my memory of how when the family comes and get support, regardless of the physical setting, but to trust, and then to continue. Itu cerita yang is etched in my memory. Okay, yeah.
Beautiful.
And then
Jangan lari daripada
lari,
soalan
soalan.
saya.
So having done it over the 10 years, and really what saddens me often is it's not fast enough. What we are doing has not had the benefit of enough therapists, faster pace of growth of services. Of course, there's that big service gap for when the individuals grow into adulthood. That is still a discussion we've had for the last 10 years, which I think in Kuala Lumpur, maybe we've seen some new services for adults, but generally speaking,
Tak cukup.
it's
Sangat-sangat kurang.
sangat it's just almost criminal, Nori, if I can use the word. So that also applies not only to the older age group. I think what cries out in my heart is that because there's not enough therapists, then this issue about the cost of therapy, kan? Supply demand, we cannot get away from the fact that the fees then cannot be lowered as much as we can. But it's not about the fees that gets lowered. We need to recognize the value of our therapists. The value of our therapists in simple terms, what salaries they're getting, how are they able to continuously learn, because learning comes with a cost. That's why Oasis Place, we continue to do professional development, and although the fees are what we call private level fees, oftentimes we will invite the non-profit individuals to be part of the team, or people from the public sector to come and learn together. So what can we do better? I'll love that we can speed things up. I believe we can collaborate a lot more. I think the call out to action for PPP, private public partnership, has been made. So what can we do? That's why Desiree, earlier we spoke about one type of advocacy I do is I go down. I say go down, but I go to the root level of events at different locations, different organizations, just building friendships. That what can we do? Where can we do more together? In Malaysia Day Camp, our collaboration with the Scouts, a non-profit NGO. Scouts is actually a non-profit organization, has delivered a really amazing experience, both for Scouts, for our campus, and our professionals.
Because all your campus are neurodivergent young people, kan?
To create inclusion. And we now love to be doing more and more, for example, with the Kiwanis. We've done in the past with the Rotarian. Yang mana-mana lah. Sama ada Nasom, siapa-siapa yang ingin, just let's collaborate. Because there's too much to do. And although we are swasta, private practice, I welcome the competition because there's there's not enough of us.
Competition anymore.
It's like this is my this whole episode not speaking very much. My contributions have just been tak cukup, sikit. But it's true. It's just like it's sadly sitting down, reflecting, and going.
Showing up is
Yeah, we're right
advocacy.
here.
Agreeing is advocacy as well. So
And I want to add,
today.
advocacy of what I'm doing is not
kita-
something new at all.
Kita nak
Nori.
bantah sebut Giant tadi ni. Malu sekejap.
No, because
okay.
there are many
yeah.
who have gone before us. Kan? You ada meet some of the old pejuang.
Yeah.
who set the
No.
stage for us,
Who
and
has set-
now we need more. It's not enough of
those shoulders that we're standing on.
So,
Betul-betul.
I will pull out and draw on the more positive side of me
yeah.
and say, let's press in. Press in, press on. We need you governmentally. We need you whether you're a professional, a volunteer. If you're a student, you are so important to us. Why? Because we would like to invite you.
You are the future.
You are our future.
are
We want to
future.
invite the next level of students, whether you are still at college, whether you are already in university. Come and look at healthcare within the allied health professions.
Yes. Yeah.
So I have an interesting cerita which I think none of you know, which involves Kakak, and I think we all know how everyone met. So
Yeah.
and Kakak and I know how we met. So I was speaking, but my reaction to how we met, I've not shared with anyone.
Okay.
Because Oasis Place had been one of those aspirational places for me to bring Hans for speech therapy. We struggle so much with speech, kan? I think pernah Desiree share dalam episode sebelum ni that struggle so much because of the knowledge level of certain speech therapists who may not know what autism is, right? Or how to handle children with autism. And of course, the kekangan memang tak cukup. Memang tak cukup therapist. So, in my extensive research, memang dah kenal this place called Oasis Place. And I was very specific. I wanted those trained in the Hanan approach. So it had been, and also because of the waiting list, and also at that point, I think Oasis Place ada satu atau dua saja therapist. One was like a locum, only comes on weekends, that does Hanan. Bukan semua are trained in Hanan, right? So there was waiting list plus cost, so it was aspirational lah. So memang dah said put aside the cost, okay, tunggu waiting list. And then I was on this Kiwanis Malaysia Academy Symposium. I was a speaker, and it goes back to showing up. Kakak shows up everywhere, right? For events to support, and this was an online event just coming out of pandemic.
Yes.
And Kakak SK sent me a private message as I was speaking to introduce herself and gave me her phone number. So what does Desiree do when she sees someone's name and phone number? Pergi Google lah, siapa ni? And oh my goodness, my heart went like duduk. She's the founder of Oasis Place. And I was like, oh my God.
Oh, Desiree, I've never heard this
so that's why I
before.
said I've not told this story. So I was like, oh my goodness. Mencari all these therapists and all that. And then like,
Mother of Oasis Place.
she texted me and gave me her phone number. So it was like a very wow, like fangirl moment lah. When I got the,
Oh, thank you for
got the
sharing that,
phone number.
Desiree.
So
And
Yeah.
then I connect to, I think like us, we connect heart to heart. Kan?
Yeah.
When we can see you must have been delivering something, and I wanted to connect.
yeah, the parent story. I was supposed to tell my story as a parent.
Yeah.
At that time, I think Hans was 5. I think 5 years old. So yeah,
Itu dia.
interesting.
Itu dia.
Ya, so banyak kami telah mengenali dengan lebih mendalam tentang Kakak SK hari ini. I think we are ready to wrap up the episode. Anything else anybody wants to share before we close off?
No, but just listening to myself sekarang, actually I'm again a note of gratitude, that you all had pulled and pushed me to be part of the voice in Kita family, but also just listening again. I'm happy that it's not about me individually. That Oasis is the Oasis that we want to have for all the different individuals, not only the clients but actually also for the professionals. I think that's something now in a quick reflection. So thank you. Terima kasih.
Thank you, Kakak, for all that you do.
Yeah. No, I'm just glad that you chose to do this. Because kita doktor memang lebih ramai daripada pakar yang datang daripada bahagian kesihatan bersekutu ni tak cukup sangat. So I'm glad you jumped over. Yeah, yes. No, it's true. Anybody else want to jump over?
You're invited.
Dipersilakan. Sangat dialu-alukan.
Yes. Okay, no, that's it. Kami pun bersyukur. I think kakak's the other connection point. So I know all of you, but I think she also knows
all of us have been to Oasis at some point, whether it's our kids or us ourselves as parents going for training, attending events. So thank you, Kakak, for all that you do.
Thank you so much. That's why I think we needed to have this one special thing also. You have been the learning journey. So it's on brand. It is you. The learning part of our journey is very much connected to you. Terima kasih.
Terima kasih. Thank you.
So on that note, thank you for listening to us. Jangan lupa like, share and subscribe. We are on Spotify and YouTube for full episodes, and follow and like us on our social media accounts, TikTok, Facebook and Instagram. Salam sejahtera and goodbye till we see you again.
Bye.